Hey, good afternoon, everyone. We're here to go about what you can do if you're suffering from lower back pain. Now, the pain we're talking about right now is going to be more of the general lower back pain from sitting too much at the desk, driving too many miles on the road, maybe lifting a little too heavy, or throwing your kids in the pool. Something of a muscular sprain, strain, more of a general lower back type of activity. Disc herniations, sciatica, neurological problems might respond better to different types of treatment that we'll get into later on. But for the time being, we're going to go over some 5 of the 6 best things you can do if you're having some lower back problems. Now, first one we're going to do is historically called the pelvic tilt. So what we're going to do is we're going to have you lay down on the table, and our knees and our legs are kind of angled at about 90 degrees. We're going to rest comfortably on the table. And I know there's black on black here, you might not get a good view, but what we're doing in this case is we're trying to kind of round out our lower backs by tilting our pelvis. So we're going to be tilting our pelvis down and back. And this activity, we're going to hold this tilt for about 2 to 3 seconds, and we're going to repeat it about 8 or 10 times. So again, these are pelvic tilts, where we're going to be tilting our pelvis up in this direction. And we're going to be repeating this about 8 or 10 times with a 2 to 3 second hold. Now, we're going to move on to the next exercise, which is going to be called the pelvic bridge. Okay, very similar to the tilt, except we're going to get a little bit more active. So in this case, we're going to stabilize our hands at the side. Again, our knees and our feet are kind of stacked in unison. We're going to be bracing our stomach here, and then we're just going to simply lift the pelvis off the table, bringing our belly button to the ceiling while clenching our glutes. And we're going to hold this for, again, another 2 to 3 seconds. And we're going to repeat it 8 to 10 times. Now, these activities we can do 2 to 3 times a day, but it's important that we kind of mix them in at the times we need the most amount of relief. So we've done the pelvic tilt and now the pelvic bridge. Now we're going to move into a series of simple lower back stretches. The first stretch is called the knee to chest stretch for obvious reasons. We're going to be simply bringing our knees up towards our chest. Now, for those with healthy knees, this is a real simple stretch. Hands around the knees, and we're going to be approximating the knee towards the chest, seeing if we could get a nice little stretch in our glute region or back pocket, if you will. Now we're going to hold this for anywhere between 15 and 30 seconds, and we're going to repeat it 2 to 3 times. Now, for those with bad knees, if this kind of hurts the knee, if we have severe osteoarthritis or any other type of knee complication, we can simply go underneath the knee and do the same stretch without putting a lot of pressure on our knees. And again, 15 to 30 seconds, and we're going to repeat about 2 to 3 times on this side, and then we'll come back and we'll do it on the other side. These should all be relatively comfortable. None of these stretches or exercises should induce any sharp pain. If it does, then we move on to the next stretch and try again. Now, after we do 2 to 3 on each side, oftentimes we'll do what's called the double knee to chest. So we'll bring both knees up together, and I suggest you bring one at a time. So notice when I did it, I brought my left one up, and then my right one, bring my hands together, and rock backwards. Oftentimes, this might be a little more difficult to do in the more severe lower back cases, so it's not something we want to force, but if we did want to do it, another very acceptable stretch, a double knee to chest. Like our other stretches, we hold it for 15 to 30 seconds, and we repeat 2 to 3 times. Now, letting go of the stretch, it is a formula where we let one leg go, and then we let the other leg go. If we drop them both together, sometimes that'll strain the lower back. Now, next stretch we're going to do is a simple trunk rotation, where hopefully you can see it well in the video. We're just going to be keeping the knees together and moving the hips in unison to one side. And we're going to hold this again 2 to 3 seconds. We're trying to keep our shoulders square on the table, head looking up to the ceiling. And then we're going to rotate in the other direction, trying to bring our knees as far as we can towards the table and keeping our shoulders squared away on the table or the floor. Each rotation we're going to do about 2 to 3 seconds worth. And in total, we're going to be doing about 8 to 10 rotations side to side. Now, last stretch we're going to do is called a child's pose. So for this one, we're going to flip on over, and we're going to get into more of a kneeling position, and we're going to try to keep our buttocks down on our heels. Try to approximate heel to buttocks while we kind of slide forward. So in this case, we're going to slide as far forward as we can while keeping our heels on our buttocks. Now, this child's pose, like the others, should be held for 15 to 30 seconds. And we're going to do it again 2 to 3 times. And we can mix this up throughout the day and do more than 2-3 times a day. However, at the very minimum, let's go through what we just showed you at least once to twice a day. Again, these are general stretches that you can do, general activities you can do to relieve some of that lower back pain brought on by more musculoskeletal causes rather than disc-like causes.